Hello, welcome, and thanks for joining us on this edition of News 2. I'm Sandra Gaman-Singh. Topping our newscast, thousands of government workers and retirees can breathe a sigh of relief. There'll be no lapse in their health insurance coverage. On Tuesday night, senators passed the fiscal year 15 budget and was able to ratify the health insurance contracts, which the governor signed to continue coverage. News 2's Erica Parsons has more on the story.
Lawmakers and Governor DeYoung beat the race against the clock to renew government employees and retirees' health insurance policies. Senators passed the fiscal year 15 budget late Tuesday night. Finding more than $6 million to pay health insurance increases was one of the challenges.
The additional $6.24 million came from $19 million that the government received in retro funds from the MEP program. The governor outlined some projects that he wanted that money to go to. And what we did is we shaved the 6.240 away from several of those projects.
Senate Finance Chair Clifford Graham said they'll get that money back.
Cigna said to us that we will get back about $7 million in refund in overpayment, and that is slated to come in January. So there is also a section of that bill that provides the money back to the entities that we took it from.
Senators ratify the health insurance contracts that cost nearly $160 million. Governor DeYoung signed the agreement so government workers' coverage could continue effective October 1. Lawmakers passed a total budget of more than $550 million, but they cut the governor's budget and put a cap on executive spending. Senators voted to approve a measure proposed by Senator Craig Barshinger that reduced the budget for the governor's office by almost $7 million. Senator Graham offered an amendment to restrict an outgoing governor from spending more than 25% of that budget.
It's something that's been in the rules of the legislature, so no Senate can spend more than 25% of the budget outgoing Senate, because you can theoretically spend more than 25% and then an incoming Senate only have 75% or less than 75% to run for 9 months. And it's the same premise that we're doing with the executive branch.
Erica Parsons, News 2.
Governor John DeYoung also signed the renewal contracts Tuesday night for the government's system group life and accidental death policies. Those agreements were also ratified by the Senate. Well, the Committee on Homeland Security, Justice, and Public Safety, chaired by Senator Kenneth Gittens, held a public hearing today in the Fritz Lewitz conference room on St. Croix, where issues were addressed concerning public safety and various law enforcement and emergency service agencies. Invited agencies were the Virgin Islands Police Department, Bureau of Corrections, and the Virgin Islands Territorial Emergency Management Agency, or VITEMA. Elton Lewis, VITEMA's director, said in his testimony, one of the many problems facing the agency noted by the director is that currently both the St. Croix and St. Thomas St. John District 911 emergency communication centers are in dire need of emergency 911 operators. Now, also testifying on behalf of VIPD, Assistant Commissioner Thomas Hanna said that the department is at the crossroads of becoming a better law enforcement agency. He said he believes with the resources for both personnel and support systems, they will meet their #1 priority, such as reducing crime in our neighborhoods. According to Hanna, in the offices of the chiefs of police, they have developed a multi-layered approach to proactive law enforcement. He added that they are working comprehensively and are united in their purpose of a safer Virgin Islands. Well, as we reported, the Department of Health is cautioning residents on an illness spreading on the mainland. The illness affects mostly children and is the cause of concern for parents and health officials. We take a closer look at this vaguely known respiratory illness, how it manifests in patients, and how to stop it from spreading. News 2's April Knight has details.
As chikungunya continues to plague households in the territory, the Department of Health is warning residents of another illness sweeping rapidly across the United States.
The Virgin Islands Department of Health is closely monitoring national reports of an uncommon virus called enterovirus D68.
It started as a mystery illness. Children were getting sick, seemingly with a common cold, until it turns into a serious respiratory problem. Some children even experience paralysis. Now, what CDC is calling enterovirus D68 has been reported in at least 45 states, and the local health department is urging parents to beware.
Enterovirus is a respiratory illness. Symptoms can include fever, runny nose, sneezing, coughing, and body aches.
In some stateside cases, paralysis sets in. It's spread from person to person, from touching contaminated surfaces and then touching the eyes, nose, or mouth, and from infected persons coughing or sneezing. Children, especially those with respiratory problems like asthma, are most at risk.
Parents should keep a closer eye on their children if they are experiencing a bad cold, wheezing, or a kind of crackling noise in their chest, or difficulty breathing. Seek emergency medical attention.
The health department urges frequent and thorough hand washing, avoiding personal contact with infected persons, and disinfecting as often as possible. There are no treatments or antivirals available for enterovirus at this time. Doctors in the states who've studied the illness are not even sure about patient recovery.
I think that is still an unknown question in terms of will these kids fully recover or not. We don't know that.
Reporting for News 2, I'm April Knight.
Commissioner Plaskett encourages residents to visit the health department's website for more information on this illness. Be sure to count on 2 to keep you updated on the status of the spread of enterovirus. Meanwhile, the number of new cases of chikungunya is still growing. Health officials have been spreading the message of protection against the mosquito-borne illness in communities and through the media. Last Friday, nursing students and members of the public also attended Fight the Bite training to share with others how to stop the spread of chikungunya. Residents again are urged to go to the Department of Health's website to find more resources on the Fight the Bite campaign and stopping the spread of chikungunya. The public is encouraged to attend a health fair and tour the new mobile medical clinics. The Department of Health will hold a ribbon-cutting ceremony that's Thursday at 9:30 a.m. to 3:30 p.m. at the Sunnyale Shopping Center on St. Croix and Tutu Park Mall on St. Thomas. The 40-foot state-of-the-art mobile clinics are equipped with 2 exam rooms, a small lab, an intake and assessment area, and restroom. The mobile clinics are also capable of electronic medical recording through its Wi-Fi capabilities and are protected by a security camera system. We'll have more. October is Breast Cancer Awareness Month, and Sigma Theta Omega and Rho chapters of Alpha Kappa Alpha Sorority Inc. They have partnered with the American Cancer Society in the nationwide campaign to increase awareness of the disease, which is the second leading cause of death among women. Be sure to register for the upcoming Making Strides Against Breast Cancer Walk on Sunday, October 26th at the Austin Babe Monsanto Marine Terminal in Crown Bay. Businesses are also encouraged to go pink in October. Beginning on Friday, there will be registration drives, and there's the information there. You can contact the American Cancer Society's office for more information at 775-5373. Now be sure to tune in to News 2. We will be sharing information about breast cancer the entire month, the stages and treatment options, and much, much more. Turn our attention overseas. Texas hospital officials are admitting they mishandled the first U.S. Ebola case, and school children may have been exposed. The Ebola patient told ER doctors at Texas Health Presbyterian Hospital that he was visiting from Liberia. He was sent home and returned 2 days later worse than before. Texas Governor Rick Perry said the patient had contact with 5 school-aged students who are not being monitored at home. CDC experts are going door to door in the Dallas area looking for anyone who may have come in contact with the Ebola patient between September 24th and 28th. Keeping our eye on the economy, shares of companies studying and testing Ebola vaccines climbed in after-hours trading after Centers for Disease Control announced that first case of Ebola diagnosed in the U.S. The World Health Organization is trying to speed up the use of some experimental vaccines. Here's a look at the New York Stock Exchange with our stock market watch. Everything down. The Dow 238, NASDAQ 71, S&P 26. Coming up on News 2, a tropical wave is lingering nearby. We'll have much more coming up. Be sure to tune in to News 2 AccuWeather. Well, following a suspension by the St. Thomas St. John Board of Elections, board member Wilma Marsh Monsanto wrote a scathing response addressed to Joint Board Chairperson Alicia Wells and District Chairman Arturo Watlington. According to Monsanto, the resolution to suspend her was passed in a meeting where she was absent because the time was changed at the last second. She also claimed that Watlington made false allegations against her. In an interview with News 2, Monsanto again stressed the reasons why she decided not to participate in the post-deadline attempts to certify the primaries, which occurred on August 18th and 19th. Monsanto said she is rejecting the board's suspension.
Certification would have been illegal because the law stipulates and gives a particular date that it must be certified by. And if I were to sign that, that was way after the fact, and I would not have been a part of that. I have never missed a board meeting. Never missed one, and I don't intend to miss any. I wonder what they mean by a resolution. Even a resolution signed, but the governor has no weight to it.
Count on 2 to keep you updated. On Tuesday night's edition of Talk 2, the guest was the administrator of the Government Employees Retirement System, Austin Nibbs. With the amount of people he says in the system increasing annually, less contributions going in, and more benefits paying out, Nibbs talked about the restructuring of the system.
The first year that we saw that was in 1996. There was a $1.6 million deficit, and it has started to increase because you started to have a lot of individuals going home because this system started in 1959. So
people became of age, and so they started going home, and so those positions were not replenished.
Well, they could have been replenished, but probably they were replenished with lower paying employees.
So now your contributions are even lower, so
Correct.
The deficit increases. Now, during these times between the year 1994 and 2013, now we know of the $13 million that were borrowed from the government basically to sustain the payments, the incentives for the people to get an early out. But during that time, was there any other time that the government borrowed money out of the retirement system?
I'm not aware of that.
Be sure to tune in to Talk 2 every Tuesday night at 7:30. If you haven't converted your home to Innovative's new Evo network, now is the time to do it. Innovative's new fiber network is available throughout most of the territory, and existing customers are urged to contact the office to schedule the installation.
We're rolling things out node by node, area by area, but we really are trying to accelerate the project, and we're encouraging our customers to pay attention. In order for us to complete this project, we have to start to disconnect customers who are on legacy in areas that are Evo ready. So please pay attention because we have been sending out information. At the end of the day, we want our customers to transition seamlessly, but if we don't adhere to certain timelines, a customer will be disconnected. Although they're disconnected for regular service, they will be able to still make 911 calls, so they won't be cut off from emergency services.
Well, CBS TV2 as well as some cable channels have been experiencing sun outages the last 2 weeks that affect our CBS programming. The event Sun Outage happens 2 times a year. Each will take 5 to 10 days each for about 10 minutes. That's when the sun overpowers our satellites. It's a natural phenomenon that occurs when the Earth's satellite and the sun orbits along the same line. And we do apologize for the inconvenience. Be sure to stick around. A tropical wave is in our area, so we can expect some showers. Bernie has an update coming up next.